Welcome to this video, where we're going to discuss the lowdown on breastfeeding and constipation. We'll look at what causes it, how you can prevent it, and some tips for managing it if your baby is affected by constipation. 1. What causes constipation in breastfed babies? There are several potential causes of constipation in breastfed babies. It could be due to a lack of fiber in the mother's diet, milk going through too quickly during feedings, or an immature digestive system. In some cases, the baby may have a minor digestive issue that needs to be addressed by a doctor. 2. How can breastfeeding mothers prevent constipation in their infants? The good news is that breastfed babies are less likely to experience constipation than those who drink formula. Even so, mothers should pay attention to the following tips to ensure their baby's digestive health stays in top condition. Breastfeeding on demand. Allowing your baby to nurse often helps keep the digestive system running smoothly. This means allowing your little one to feed as often and for as long as he/she wants. Keeping hydrated. Ensure your infant drinks plenty of water between feeds or during hot weather. You can also try giving him/her some cold boiled water after a feed, or when you want to give them something extra in between meals. Going organic with foods. Start introducing solid foods slowly and focus on giving your baby organic, unprocessed fruits, vegetables, grains, and proteins. These foods are easier to digest and provide the necessary nutrients for optimal growth. Keeping an eye out for signs of constipation. Signs include a decrease in bowel movements, hard stools, or visible straining during diaper changes. If you notice any of these issues, consider consulting with your pediatrician to ensure you're taking the right steps in managing your child's condition. 3. Are there any particular foods or drinks that may help with managing infant constipation? The answer is yes. There are a few dietary changes that may help babies suffering from constipation. This includes increasing their intake of water and other fluids, such as breast milk or formula, which can help soften stools. Additionally, foods high in fiber such as whole grains and fruits may help relieve constipation. Eating prunes or drinking prune juice may also be beneficial for infants experiencing constipation. If you're breastfeeding your infant, you should increase your own consumption of these types of foods to ensure that your breast milk contains the nutrients necessary for stool softeners. If your baby continues to have issues with constipation despite these steps, it's best to contact his or her pediatrician for further advice. 4. Are there medications that can be used to treat baby constipation caused by breastfeeding? Yes. There are medications available to treat constipation in babies caused by breastfeeding. These include osmotic laxatives such as polyethylene glycol PEG, lactulose, and docusate sodium, stimulant laxatives such as senna and bisacodyl, and stool softeners such as docusate calcium. However, it is important to speak with your pediatrician before using any medication for your baby's constipation. Never give a laxative or stool softener to a baby without first consulting a doctor. It is also important to make sure that you are following safe breastfeeding practices while treating the condition if you suspect that it was caused by nursing. 5. Is it important to consult a doctor if my baby experiences frequent bouts of constipation while breastfeeding? Yes. It is important to consult your doctor if your baby experiences frequent bouts of constipation while breastfeeding, as it could be a sign of an underlying health issue or even dehydration. If left untreated, chronic constipation can lead to more serious issues like an intestinal blockage. Also, keep in mind that what may seem like normal constipation for one baby might not be considered normal for another. Your healthcare provider will be able to help you determine the best course of action for your baby's specific needs. Furthermore, they can review any dietary changes you should make in order to address the issue and provide other strategies, such as increasing water intake or adding fiber-rich foods into their diet. 6. Does the type of formula I feed my baby have an effect on its likelihood of getting constipated while breastfeeding? Yes. The type of formula you feed your baby can have an effect on its likelihood of getting constipated while breastfeeding. The most common types of formulas that may cause constipation in babies are cow's milk-based formulas and soy-based formulas. Cow's milk-based formulas contain more protein than breast milk, which could potentially lead to increased stool hardness. Soy-based formulas also contain a high amount of proteins that may be difficult for some infants to digest. Additionally, some specialized infant formulas are designed with greater amounts of prebiotics and probiotics that can help keep your baby regular. Talk to your doctor about which type of formula is best for your baby if you're concerned about the potential effects on their digestive health. 7. What other advice would you give parents who are dealing with a breastfed baby suffering from constipation? If you are dealing with a breastfed baby that is suffering from constipation, it is important to talk with your pediatrician or healthcare provider. They can assess the severity of constipation and provide advice on how best to help your child. Additionally, some tips that may be helpful include encouraging frequent skin-to-skin contact between parent and baby, as this has been shown to help ease discomfort in constipated infants. Massaging your baby's tummy gently in a clockwise direction to help stimulate digestion. Offering plenty of fluids throughout the day such as water, formula, or express breast milk for older babies. Switching up breastfeeding positions to encourage digestive movement. Giving your baby supplements such as probiotics or prune juice. Introducing pureed fruits and vegetables into the baby's diet to help add fiber to their meals. Keeping a diary of your baby's bowel movements so you can track any changes in frequency and consistency over time. We hope this video gave you a better understanding of the relationship between breastfeeding and constipation. Remember, if your baby is having difficulty passing stool after feeding, it's important to consult with a doctor or pediatrician for advice on how to best support them. If you have any questions about what we discussed in this video, please leave us a comment below. We love hearing from our viewers, so don't forget to like and subscribe for more informative videos like this one. Thanks for watching.